Boker Tov, everybody in the Pilzno community and in the world at large. This is Dr. Bekermus, and this is the second segment of our talk on general health. We discussed last time Dr. Jacob Teitelbaum's acronym SHINE, S-H-I-N-E, as something to remember for general health, and the S stand for sleep. So he puts sleep first, optimally, because we regenerate when we sleep. We reboot our batteries. It's very important to have not just the amount of sleep adequately, but the quality of sleep. So, eichut and kamut. So we should be sleeping at an average of 8 hours a night, but also a good quality sleep, where we have REM and alpha sleep, and we wake up feeling refreshed, and we know that our cells were regenerated and rebooted. One way to tell if we slept well and deeply is to have dream recall. So when we wake up in the morning, we can say, oh boy, did I dream last night? I don't necessarily remember the contents of the dream, but I dreamt a lot. And that's an indication of an adequate amount of B complex, vitamin B. Dr. Carl Pfeiffer, one of the original orthomolecular psychiatrists in the United States many years ago, who I worked with, would use high dosages even of B complex in mentally ill patients, even with schizophrenics, and noted that that was parallel to dream recall. So also to note is that adequate amounts of vitamin D are very important, and on a blood test it should be between 60 and 80. If you type in YouTube vitamin D and sleep, or vitamin D and sleep apnea, then you'll see studies that show that vitamin D is very important for the good quality sleep that we need. And noting also that we should be nose breathing and not mouth breathing. If you type in nose breathing on YouTube or mouth taping, you'll see that there are 30 functions of the nose that the mouth doesn't have, but including a certain oxygenization and filtering that's necessary for a good night's sleep. So I use surgical tape, a regular white piece of tape, to tape my mouth, even with my growing mustache, and it ensures the fact that I nose breathe and not mouth breathe. Many patients suffer from insomnia, which also has two factors, either difficulty falling asleep or staying asleep. And there are different supplements that I recommend for each. For difficulty falling asleep, we use L-tryptophan, an amino acid, also known as 5-HTP in a different form, taken about a half an hour before sleep. To stay asleep, if somebody wakes up at 2 o'clock in the morning and wonders, what am I doing up? Then we might recommend melatonin prior to sleep, or GABA, G-A-B-A, either prior or even during the night if you wake up and you just take a little GABA, either in a powder or a capsule. It reduces excitable brain activity, meaning the brain's working a mile a minute, and you might be able to fall right back to sleep again. So that's a synopsis of sleep. I hope everybody gets a good night's sleep and feels great in the morning. And we will continue this series with the next segment next time. Thank you very much for listening, and have a great day. This is Dr. Bekermus. Bye.